Good morning, good afternoon, good evening, everybody, and a big welcome to our fifth ReInvent and Rebuild webinar. We will be starting more formally in 2 minutes, so on the hour, but for those that have already joined us, we just wanted to just tell you that we're really pleased to see that you have joined us. This is the WHO webinar on innovation as an accelerator from startup to scale. So if this is where you thought you were meant to be, you are absolutely in the right place. My name is Amanda Harding. I'm going to be moderating the webinar today. I'll introduce myself and everybody else in just 2 minutes. But just a reminder for those who have joined us that we will be recording this webinar. So please just be aware of that. Partly because we actually do, out of the webinar, we do then publish the full recording and make a short video as well that will be both available on the WHO website pretty quickly after the webinar, not immediately, but within a few days. We are using the Q&A function, so that allows you to also be able to ask questions to our panelists through the 90 minutes. And we'll try and weave in the questions where we can, but otherwise we've asked the panelists and the WHO team as well to answer the questions live. It means that we will not be looking though at the chat box. So please do not put your questions or your comments into the Zoom chat box. They will, unfortunately for you, be totally ignored. However, as I said, we will be looking at the Q&A function all the time. So once again, a big welcome. Just a reminder, this is the WHO Innovation as an Accelerator from Startup to Scale, ReInvent Rebuild webinar. We are on the hour right now, so I will open a little bit more formally. So as I said, good morning, good afternoon, good evening to many of you. And we know that the crowd that joins us in these webinars comes from really around the world and from a whole range of different sectors. My name is Amanda Harding. I lead Convene, and it's really my honor to be moderating this fifth webinar in the series. As I said, innovation as an accelerator from startup to scale. To set the scene today, I'd like to welcome Fiona Ball, Unit Head of Physical Activity for WHO, and absolutely the driver of our webinar series. Over to you, Fiona.
Thank you very much indeed, Amanda, and a very good morning, good afternoon, and good evening to all of you joining from around the world to this fifth webinar in the series of reinventing and rebuilding sport and physical activity for a stronger, fairer system for all. Welcome back if you have joined previous webinars, and very warm welcome if this is your first webinar that you're joining, and we hope you stay and perhaps even join the remaining in the series. This is number 5 of 8, and we'll tell you more about the forthcoming at the very end of this. I'd like to extend a very warm welcome to WHO colleagues from around the world at headquarters and our regional and country offices, to representatives and attendees from governments, ministries of sport, health and other departments. And in today, a particular warm welcome to those of you who are in the tech industry, startups or otherwise, those of you who are interested in the digital applications and innovation and innovating hubs. We really warmly welcome you to support and participate in today's topic. This is a series of webinars that has its origins back on the celebration of the 2021 International Day of Sport for Development and Peace, a day where we celebrated sports participation, but we also recognized the impact of COVID. An impact that's affected all of us in how we're active, whether that's walking and cycling, playing sport, active recreation in the local parks. We've been affected by the closures and the disruption and the changes to our lifestyle. But we want to look forward to see how we can build forward better in the COVID recovery, to have a better system to enable everyone to get the benefits of sport and physical activity. We know it's affected the industries, the civil society, those working, and we want to hear the voices from everyone to help us build back, plan, and have recommendations on how we can work together in the future. The series has looked at different topics each week, and this week we're looking at the potential of digital technologies in particular, and exploring innovation and how we cultivate, support, and bring forward innovations to scale, with an excellent panel who bring experience from a wide diverse ways of which we're using digital tools to help us help understand the behavior, help support people change, help understand the environments people are living in, what's there and what's not there, and supporting people to start and stay active. Delighted to have the panel, delighted to have this seminar that you're joining to discuss this important topic. And while we learn about the potential, let us remember we have to challenge ourselves. These are forward-looking, practically focused, and looking for recommendations on how we can support, but ensure we are inclusive and reach everyone. So will digital technologies divide further the wide gaps between possibilities people have, or will it help narrow those gaps and reach our aspiration of physical activity for all? Thank you for joining. This is a process and a product. Join in the Q&A, join in the chat box to get links which are already coming up. And WHO is listening so that at the end of this series, we can produce a document to support the field going forward in COVID recovery, a document we hope to produce in September, October, and launch with your support. Thank you for joining. Back to you, Amanda.
Thanks a lot, Fiona. I'm just going to take a couple of minutes just to walk everybody through how we're actually going to be using these next 90 minutes. These 90 minutes to unpack, expose, and challenge, as Fiona said, the role of digital solutions in contributing to getting more people to partake in more physical activity and sport. We want to understand that real potential of tech, particularly for those who find it the hardest to access, afford, and enjoy physical activity. And here we're talking about that whole range, about women and girls, the elderly, people living with disabilities, with chronic diseases, those who have been the hardest hit by COVID worldwide. We also want to discuss how digital solutions could, even should, reduce inequalities, particularly in a context where we've seen COVID has been widening those gaps. Throughout our webinar series, we really are seeking proposals from our panelists and from you, the audience, and today is no exception to that. We want to identify the actions needed to strengthen and bridge the tech community with all those others, public health sector, sport and exercise sector, policymakers, community groups, individuals, and cities. And of course, we want to see your questions. And as I've already mentioned, these can be posted on the Q&A, not the chat, please. As you've seen, we're using the chat to share links to important, relevant information. Time allowing, we will try and weave in those questions into the live conversation. We've also asked our speakers, our panelists, and the WHO team to respond where they can in the Q&A function itself. So who do we actually have with us today? We've got a great group of panelists. So I'll start from the left with Jean-Baptiste Alliot, Chief Innovation Officer at UEFA, who has been translating the innovations developed for top elite soccer players into innovations that can get girls and boys out there playing more sport. Iris Cordoba-Mondeja from the Global Sport Innovation Center, who's acting in this hybrid area as both an incubator and a connector. And we'll hear a lot more from Iris about how that works, both supporting startups, but also what that means from a policy level as well. Grace McNamara, the CEO of Exi, building on her long experience from Apple to now connect data to patients and health providers with physical activity programs. We have Chantal Sati, youth leader, but also CEO of her own startup, while also at the same time working on her PhD, so seriously multitasking. And lastly, Alex Zorita, running the Sport Tech Hub at London Sport, who has pioneered and championed digital solutions in London and beyond as key strategies to make sport accessible and affordable. So as you can see, we have a great group of panelists. But to get going, let's just sort of ask that very first question that we want to sort of kickstart our conversation with today. And as you'll get a sense of, this is definitely a conversation. So what is the potential, and Fiona talked to this, what is the real potential of digital technology and innovations to engage more people? I'm going to ask JB to start the conversation with us, really because, you know, working in UEFA, working and leading an innovation hub, you're working with elite athletes in the world's most popular sport. You know, running this innovation hub, you have a stated mission to increase the participation of girls and boys in football. And one of your initiatives has seen the transfer of tech developed for elite soccer teams to engage others in their backyards, in their parks. As a soccer confederation, what are you really trying to achieve through this program? I think for some people, this will come as quite a surprise that you're even doing this. So what are you actually trying to achieve, JB?
Thank you for this question, and thank you for having me today. I think it's important to start by saying that the UEFA Innovation Hub is at the service of an overall strategy. And the UEFA strategy for 2019-2024, you have 4 pillars, and the number 1 is participation. So UEFA is a non-for-profit organizations, and our members are the federation in the different countries in Europe that help promote the physical activity through football. And so as one of our first pillars of our strategy is participation, we've been looking at ways that we can help engage with young boys, young girls, but also adults in terms of how we can make sure that participation is not like going down at least, but can rise. And so we are definitely looking at new technologies or innovations in that space or in the digital space to make sure we maintain a good level or even increase the level of participation. And this is due to the fact that we all know that there are new demands. We all have new habits, new behaviors that are impacted for the last 10, 15 years around the arrival of new technologies like smartphones. And so we need to question, or we need to adapt, and we need to make sure we remain relevant for the younger kids that still want to practice, but maybe that are expecting something else. There are other forms of sports, but also of entertainment outside there, and we need to make sure we remain relevant to these people. And yeah.
So, I mean, maybe you could just tell us a little bit more then about any of the key design features that you built into the program to make it successful. Because again, I think we're trying to sort of struggle between here using tech, but at the same time, you want people to actually be actively, physically active. So maybe you can sort of get us to understand what that is and what the program really looks like.
So what you're pointing at is one activations we made with one startup. So it's a long-term partnership actually. So we've been working since the 2019 Startup Challenge with a startup that actually just through your phones you can record yourself practicing some of the skills. So passing, dribbling, kicking. And so when you kick, you have either a real post or you have a virtual reality post, and based on your speeds and the accuracy of the kick, you have a score. And so the idea here is to allow any kid, boys, girls, or any adults to go in the garden or to go anywhere and to practice through this app in terms of like, okay, how do I score with my passing, with my dribbling, with my running? And so we have 6 core skills to maintain it as simple. And we use quite a lot of gamifications, obviously, in terms of like looking at yourself, and then you have a player card. So for those of you who know it, it's a bit based on the EA Sports, so the video games, in terms of like you can become your own hero with your card based on your own personal skills that you've been practicing in your garden. And so this is how we've been working on this app. Actually, at the beginning, it was not necessarily meant for this purpose. It was solely under some kind of marketing activations, like in the fan zones, where you could come and you could see yourself kicking. But when we saw the technology, we thought like, okay, but actually we could do way more than purely using it in the fan zone for any kind of activation. And so we were thinking how this can help us in terms of engaging with new audiences or with younger audiences that wants to actually practice and get better. And the best way is to say, you can practice in your garden, you can practice with your friends, you can have like some kind of competitions between your friends, because you can look at different scores. And the beauty of it, what we're trying to achieve is that you can actually, after that, if you want to improve, it's not just by paying or playing online. It's you need to go back to your garden and you need to practice again. So that's
a couple of questions. I can ask you just a couple of questions that come up straight away, because I can imagine everybody has questions now. One question is, do you have any idea, do you have any idea of numbers, girls, boys, that have actually started to actually activate this? And the other question is, you've talked about gamification. Is that an essential part of actually trying to get young people moving from gamification on their smartphones, assuming they have smartphones, to gamification actually being physically active on the game itself?
So on the first one, I can't. We still have some confidentiality clauses, but we've been using it for more than 1,000 of young boys and girls in 3 different regions. So US, Australia, and Europe. So we have quite a good sample, and that's how we've been developing the product with our startup partner. And on the second question, it's actually the end goal. I mean, what we call is phygital, or between physical and digital. And so we're trying to have the digital space as a way to go back to the physical. The reality is that today, most of the kids have a smartphone. I'm not going to say whether it's good, whether it's bad. It's not up to us to decide this, but yeah, every adult and now even like teenagers, they are on their phones or they're using it. So the idea is like, how can we best use this to actually put them back on a pitch or to be playing together? So that's really at the core of it. And obviously gamifications in terms of like incentivizing or kind of nudging the participants that just want to play is clearly something that we are using as well. But there is no wrong into doing this. It's more like if you play even at grassroots level, you just want to maybe challenge yourself or see where you stand compared to your friends, or just want to improve a little bit your game. And so that's part of it.
JB, thanks. I mean, first of all, very inspirational. And of course, the question that this idea of nudging and that sort of nudging approach is something I think that will trigger lots of thoughts amongst a lot of people around the room at the moment. How far has this experience been something that you've been able to see influence maybe other confederations or federations globally, global North, global South, outside of the UEFA direct sphere of influence?
On this one, we've not have direct relationship or contact. I think it depends as well on the level of development and advancement. So you would have to see with the different sister confederations, so CONCACAF for North America, or even CONMEBOL for South America, or CAF in Africa. But I think it will depend on the level of development. The way I see it is like it will take maybe more time for less developed countries, but that's due to the network available, to the technology available to the people. But clearly that's something that ultimately everybody will be using it. And at the end of the day, also what's important to know is, as a non-for-profit or sports organizations, you're trying also to promote some kind of social benefits, or you have in mind other values or objectives than purely business reasons. And so that's why it's important that we are a bit more in the driving scene in terms of designing and putting these kind of solutions out there, so that we are also not conflicting with other practices that we are fighting. So one example is transfer of minors. That's prohibited. We don't want any transfer prior to 18 years old, and FIFA regulations are here. But actually, if you look at it, and most of the apps could be a way for professional sports to actually scout and recruit young players, which are below 18. So I think that coming up with this kind of technology and this kind of app, you know where the data sits, you know how they will be used, and you can make sure that it's more for social benefits. And I think in terms of like at the global level, it might take a bit more time for certain regions to come up with similar solutions, but this is mainly linked to the level, I think, of advancement or development of the country and the digital capacities, I guess.
So I mean, it also begs the question then that if we've been talking about this in this realm of soccer, do you think this approach has potential for other sports? And do you know of anybody else?
So I'm close to the NBA, and the NBA has been working with home court. I know there's Get Metrics, Playform in soccer. You have plenty of other solutions, even in tennis. So individual or team sports, every sports will be using or will be more and more using and relying on such technology to engage with the new audiences. But it's also because you want a level playing field, so you want to increase it, and so it's a better way also to coach, to better understand, and it's part of a wider strategy in terms of how do you engage and how you make sure you have a more competing landscape as well. Because one of the federations, so the KNVB, so the Dutch football federations, we've been working with them as well in terms of rethinking or redesigning how you want to practice and how it is coached. So rather than having slots every Wednesday or Saturday at the same time, maybe we could have something a bit more flexible, which is a bit different, that is within the city center. So we've been testing some of a Strava concept in terms of like, okay, you come, you practice, but you do it more as a fitness, like physical activity type than purely football. And it can be like with friends, so a group of 10, 15 people, and it can be on a Tuesday evening, it can be on the Thursday evening. I mean, you don't have like compulsory slots. So it's also rethinking a bit how the game, how football and how every sport will be played, coached, and how people will engage with it. And you just need to make sure that the offer you are giving them or the value proposition of the sports organization fits with the new behaviors, fits with the new demands, keeping in mind that we want people to remain active, to play better. So that's part of a wider strategy that we have.
It's fantastic. JP, thank you. And you've offered me the perfect segue actually into bringing in Alex, because you immediately were talking about, the example in Amsterdam, and then here we have, a sort of a great city example. Alex, you're working in you could say sort of a similar space, but actually also a very different space to JB. It's sort of there's sort of crossover there, but also particularly because you're working in the innovation lab at London Sport, and you are using digital technology and particularly big data. And we've heard a little bit about data already from JB to connect opportunities and programs on physical activity more directly and effectively to that 7 million citizens of London. And my understanding is that part of that motivation is that commitment from London to become the most physically active city in the world, which is just an extraordinary ambition to have. That space between connecting government, sport and exercise providers and local communities is really interesting, and it's quite unique, really. Can you tell us a little bit more about exactly how you help better promote and deliver physical activity solutions? What does that really look like in practice?
Yeah, thank you, Amanda, and good morning, afternoon, and evening to all. Buenos dias, buenas tardes. Yeah, so for us, is I suppose an interesting space to operate. London Sport is a not-for-profit funded by Sport England and the Mayor's Office. Have been established for a number of years, and really, as you mentioned, there are strategic ambition or a strategic role is to drive London's vision to be the most physically active city in the world. I suppose touching on a point that you mentioned earlier, Amanda, and Jean-Baptiste also kind of alluded to, kind of why technology, or what's the role of technology. I suppose in that instance, let's try to think about the fact that we as a sector, I suppose the competition is not within, really. I suppose if we want to get more people physically active, and in particular we want to get less active audiences more active, in reality it doesn't really matter what they do. We can say that as a neutral body. I appreciate that if you're a football governing body, you probably want those audiences to play more football, but really I suppose we should really care about just them being more active. So other industries make it super easy through advancements of technology by leveraging digital to enable their users to put their time, effort and attention into their industries a lot easier than us, I suppose. And that's a case of why we have set up an innovation hub, set up an innovation lab, a sport tech hub, and why we're trying to bring entrepreneurs and tech products a lot closer to the physical activity sector, and actually trying to unite them as a sector rather than have them as a standalone sort of industries or ecosystems. So that's a little bit about, I suppose, the background, and that's a little bit about why technology, and I suppose for us is trying to reframe the question around, you know, should we be doing more about it? Ultimately, if we don't, other industries will continue to do so, and they would make it, as I said earlier, much easier for people to put their time, effort, and attention, resources into those industries rather than us.
So Alex, can you maybe give us an example of where you've been working and how you've seen digital solutions accelerate, if you like, or lever more people, particularly those who are the hardest or harder to reach, being able to access physical activity spaces?
Yeah, sure. So two quick examples, I suppose, in that, and accessibility, understanding what's about, understanding what I can do as a, you know, as a parent, with my family, or as a person that maybe have moved into the city. So understanding what is going on is a key pain point, I suppose, that is suffered by a lot of individuals. Research carried out, but within our sector, within our industry, shows that it's easier for people to book a taxi, to order a takeaway, than it is to book a physical activity. So a key initiative in England is an open data initiative called Open Active, which is led by the Open Data Institute, supported by Sport England. And it's really a community-led initiative. So it is about how we, through open data, can open opportunities data. And what we mean in that is by, you know, what can people do, when, how, where, how can we make that far more accessible? And then ultimately then encourage innovators to create products by utilizing that data, by utilizing those opportunities. So again, to sort of in layman's terms, is almost trying to mimic what has happened in the travel industry, where if you think about Transport for London many years ago, publish data about train times, about bus times. And then Citymapper somewhat was born out of that. And then Citymapper enables now people in cities across the world to get from A to C much easier by leveraging that data, by making them understand, you know, what train they can get, what bus they can get, or potentially that is much easier for you to walk from A to B rather than use that public transport. So that's one key example there.
Can you give like a concrete example? I mean, would your open park example be a clear example of that? Or, I don't know, linking data to walking groups or to swimming infrastructures? I mean, I guess just to sort of give people a sense of really nitty gritty what that looks like.
Sure. So we have led or carried out a digital behavior change, digital marketing program, utilizing open data and utilizing in particularly data around walking groups. And we utilize Facebook as a platform to promote, target, engage with people that fit that demographic, and then where by utilizing digital behavior change tactics ultimately led them to join and take part in a walking group. So in that particular example, we were engaging women over the age of 55, and we were connecting them to local walking groups that they can join. Obviously, other side effects around rather than physical activity, there's also the social connectivity, there's also the interaction with others. But really what enabled that project to take place is that we were able to match individuals to their local opportunities and then utilize digital behavior change in between that to ultimately reinforce that habit, reinforce the action that needed to be taken by the individual. That's one example. The other example you touched on then is around Smart Park. So a few years back, we led a post-London 2012 legacy participation program. The Olympic side, the Queen Elizabeth Olympic Park, is one of the largest, I suppose, at least in the UK or in England, regeneration projects to take place, new housing, new schooling, new health centres. Obviously, the facilities remain open and used. So we use the open spaces as a way of bringing communities together, joining new communities together, new residents that were living in those spaces, trying to unite them through physical activity. But one of the things that we found is that the park was a smart park. So it was a test bed for innovation across the board. So from energy consumption and recycling of water to actually, in our instance, how do we use data? And in that particular example is how we use Wi-Fi data and the park app data usage, as well as visitor data. And then ultimately we were looking to understand who comes into the park, when, where do they spend time, what are the routes that they take in, what are the lagging spots, or whether they, kind of congregating for a period of time. And then as a project, what we did is work with 25 regional, national, local activity providers to then deliver physical activity at the time of the user's needs or the visitor's needs. So really, I suppose, is a case that around looking at in other industries, what you're really looking at is you're looking at consumer behavior, you're looking at customer behavior. So we took participation data and participant data and trying to view it from a customer consumer point of view, and then trying to commission physical activity at the time that was potentially most appropriate to engage the mass.
It's really, thanks for Alex. First of all, that's really interesting because it's actually looking, as you said, to engage the mass seems to be a really sort of important sort of, if you like, sort of phrase and what we're going to be looking at throughout the webinar. And this idea of connecting, your sort of innovators with the seekers or solutions with the problems. The question about how we actually grow that to scale, within, your area, London to England, but possibly, outside globally. Let's come back to that in a moment. What I want to make sure that, because the time is already running, is that we bring in Grace at this point, because we've already been talking so much about the question around, sort of data, big data, not big data, how it's being used. And with you, Grace, it's a chance for us to really touch on what this actually means in relation to the health providers themselves. In previous webinars, we've heard a lot about the gap between health providers, patient needs, and physical activity providers. It's been something that's run through all these webinars. Alex has just pointed to the use of data in connecting health and physical activity providers to users. With your health and tech background, you seem to have taken a very specific direction. You've worked as a personal trainer, you've worked for many years with Apple, both within Apple, but also in terms of developing with Apple health apps. And now you're your own CEO for Exi, working with an evidence-based app and putting a tool into the hands of both the provider, a health provider prescribing exercise in real time, and to the patients who need it. So there's a lot going on here. Maybe you could just first of all start by telling us a little bit about what's different about this app, how the AI actually works, and is it really customized to individuals? Because that's going to be a question, I think, in a lot of people's minds.
Yeah, thank you, Amanda. And I love listening to JB there and Alex, and there's so much that overlaps, and I think you're absolutely right. What we're trying to do is to solve a problem that I think we've been talking about for decades. And I suppose if we to step back a moment, what we've had for a long time is the knowledge that people need to be active, right? And we know the knowledge that activity reduces illness, disease, costs on systems, and so on. And some of the simple work that Alex has been doing, for example, is trying to increase access and make people know where to find whatever activity that they enjoy. And what we also have on the kind of the provider side is we've had guidelines, right, for years around different disease states, whether it's prevention or treatment or management. And I think the fitness industry and the health industry have kind of sat separately, but yet we've also had the term of exercise as medicine for a long time. And again, it's widely accepted, we know that, right? So where we kind of fit is, this is where, we've had guidelines and now we have fantastic technologies, fantastic data, but bringing that together is really where I think where Exi fits and sits. So instead of clinicians of all disciplines, whether it's cardiologist to oncologist to your GP, being, go get active, where, let's be fair, they haven't got the time, and often I suppose the knowledge, depending on the complexity of someone's many conditions, the knowledge to say, here's exactly what you need to do. So what we want to do is to take all of the research, all of the multiple comorbidity situations of somebody who might have obesity, cardiovascular disease, diabetes, COPD, bring that intelligence together, and at the click of a button, literally click of a button, a doctor can go, you need to be active, but here's a prescription. So the same way I would prescribe a very bespoke precision drug for your condition, the exact same scenario. So here's a prescription based upon all of that science and evidence. So it'll give you your frequency, intensity, and time. Now we're agnostic in relation to how they get active, so that type of activity. And again, this is where it kind of all plays together. So it works really well with what JB talked about around, go get active in the back garden, kick that ball around, look at techniques and data and stats, and then it links in perfectly what Alex also talked about around, whether it's access to tennis courts, or whether it's in your local park, or whether it's a group exercise class or whatever. So that doesn't matter. What we're trying to do is really bring it into, let's be exactly specific of where you're at. Use the data that we know is widely available. So everyone has a smartphone. For example, your phone will record steps. Is a very basic metric. Is how do we get up your steps? Let's start there. But also it could be anything else. If someone got diabetes, for example, they could be monitoring their glucose. So how do we make sure that they're exercising at the right intensity, aware of that glucose number? How does that affect their activity today and long term? And yeah, we're trying to be, very sitting in that middle of, let's join the dots here. So it's a medical device. That's something that's quite different. Going back to your question, Amanda, the XC is a medical device platform that's evidence-based for the clinicians and evidence-based for the end user. And really what we're trying to do is bring all that science together, but hopefully also make it really easy to use, because clinicians haven't got time. We get that. And also it's just really complex. When 50% of people over 50 have more than one condition, there isn't too many, I suppose, situations where you have all that access, that research and data at your fingertips. So technology is kind of the only, I think, joiner of the bigger dots here, and being able to simplify what needs to be done today, because you got to be conscious of people in general, right, who are sedentary, and that's our target audience, is those that are sedentary, not the fit getting fitter. It is more the not reaching that GOATS guidelines. It's hard to know what to do, and it's hard to know, should I increase my heart rate? What's the chances of it being detrimental? Is it too high, especially if they're after a cardiac episode, and obviously cardiovascular disease being a huge number. So yeah, we're absolutely in that space of bringing all the existing science together, the existing data, analyzing and using that data, and ideally making it super simple. Now we're on a starting journey, and as you know, in terms of startup. Yeah, of course.
Sorry, I need to interrupt you. I mean, two questions. A question is coming through from the audience, which you started to talk to, but it's certainly in everybody's minds. You're a real expert in this area. We've had JB and Alex as well. We've got, Elise and Chantal to come. You're all tech savvy. How do we make any of this accessible and easy for those who are not so tech savvy?
Yeah, and that's actually one of the beauties, I think, of technology. And this is where, the work of the world today really is making it super simple, that actually it's in the background. You don't need to worry about it. You kind of put it on and it does the rest itself. So what we're really looking at is, don't even worry about how it operates. It's what, and I use, obviously I'm ex-Apple, so if I use the Apple Watch as the example, once that's on your wrist, you just do whatever you do in your day. It seamlessly tracks a lot of data. It nudges you to stand up every hour. It nudges you to move. It nudges you to close those rings. And so it nudges you, and it's very simple. It nudges you, don't worry about the rest. It happens, and it hopefully helps you to see what you're doing, and motivates hopefully as well you to do that. And that's where, technology I think fits in, is as people in technology world, if we can't make it super simple, we failed. So it has to be that regardless of your past use of technology, it's super simple. And I think we're going to make this even better as we go forward. We're starting to use an awful lot more of, voice, for example. So likewise, it's, don't worry about even touching a button down the line. It's just talk what you wanted to do, what you wanted to answer. And that's all possible today as well. So we think and obviously we're on a journey of making people more comfortable, but technology, as all of us are aware, needs to be super, 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 super simple. And if not, it's not going to achieve what it's set out to do.
First of all, really useful to hear. Also interesting to hear that you're also talking, you're echoing JB's, these are technologies which nudge people into changing their behavior. And I think that's sort of something that people need to sort of keep in mind. I do have a question for you, because you've sort of said, don't worry, it's sort of simple. And at the same time, I also know that you're really passionate about gender and inclusion. You know that there can be inbuilt bias into what we're doing. And we'll hear a little bit from Chantal about how she's trying to address that. But from where you're sitting, is the sort of AI that you're talking about using, and its potential, I'm assuming, beyond XE, but also with, could be lots of others who want to start using this type of AI, is it really asking the right questions to be able to address this type of bias? And does it actually need some sort of policy framework to support that as well? Because it might not just be the tech itself, but it also might need policy behind that.
Yeah, the very basic, and I'm definitely no expert in AI, and I'm some of Chantal are having good chats on the background as well. But what data and data sets, I suppose, and what comes out of AI is data in, as good as it is, it comes out. So if it's bad data in, it's bad data out, and it's bad programming. So that's completely possible. So what we need to do is fundamentally, 10x, 100x the actual data. And we've known for a long time that women are underrepresented in lots of research. So we have to create balance across not only gender, but ethnicity and location and complexity of disease states and so on. So it's huge. It has to be continued to create bigger, better, more comprehensive, more detailed data sets so we can start to reduce the bias. And I mean, hopefully get to the point where it isn't biased. But that's a huge data set. And I think machine learning, and we talk about blockchain a little bit, we have the ability potentially to do that and do that in a way that will reduce down bias, because you're completely right. Today, it's a fundamental concern of anybody who working with data that the data set isn't representative of the world. And if it's not representative of the world, what it produces isn't going to be supportive of what the world needs. And that's a challenge that we all face and have to tackle head on.
Great, thank you so much. And I am going to bring Chantal straight in, because Chantal, this sounds exactly like the space that you are sitting in, from, I guess, partly your own personal experience, from Sri Lanka to growing up in Toronto, your own passion for sport. I think you actually were a kickboxer for Oxford University, but also your interest in technology and innovation. You're using AI today to mitigate bias and address inequities, if I'm right. I hope I'm right on that. And your work is focusing on gender bias, but not only, and looking at it in the banking, the finance sector, health sectors, and others. Can you maybe talk us through how you see this as relevant, the type of applications that you could see for the sport and fitness sector? Because that would be really useful. Again, trying to be as, I guess, concrete as possible, and talking to somebody like me who is not tech savvy.
Excellent, Amanda. Thank you very much. Good morning, good afternoon, and good evening to everyone around the globe. That was a beautiful introduction. Yes, I was a kickboxer for Oxford University. Enjoyed my time there. Sport is something I'm definitely very passionate about. But also, as you mentioned before, I am starting my own AI company called Cornerstone AI. And I think when we're talking about artificial intelligence, so many people have many different meanings for it. And I think first it's good that we ground ourselves and understand what AI is first. And I know, Amanda, if you're not tech savvy, don't worry. I'm going to try to simplify a lot of the comments, or I should say, concepts for us today. I think it's best to say, if we're talking about artificial intelligence, it's an area of computer science that really emphasizes the stimulation of human intelligence and the processes that we do, but through machines. I'm also doing my PhD in international development and policy at Birmingham University, and I'm focusing on digital technology, but also taking a look at community engagement after major sporting events. Next year is the Commonwealth Games, and we're also looking at Qatar. But it's also interesting for me to say that technology has good, bad, and ugly parts to it. My company, Cornerstone AI, is focusing on the ugly parts of innovation. As you mentioned, bias. Yes, there is bias in AI. I would say AI bias is the underlying prejudice that's there in the data, and it's usually seen in algorithms and people that construct the algorithms. What are algorithms, you may say, Amanda or Fiona? Think about this very, very easily. Imagine a black box, a cube, but inside this cube contains thousands and thousands of mathematical equations. And inside these equations, all it's doing is looking for different sets of patterns within the data that's coming in. And I'm so grateful to Grace, because we have this concept that we say in data science: garbage in, garbage out. If there's bad data coming in, there's bad data that's coming out, and that does impact the statistical analysis that's there. I also think that it's important for us to see that there are discriminatory biases within AI technology. At Cornerstone AI, we are focusing on solving the lack of ethical AI-powered technology that's built for long-term sustainability. And we're specifically looking at four areas of discrimination: in age, gender, ethnicity, and also disabilities. And those are important because some of the variables in these AI technology systems may correlate to outcomes that disproportionately, which ultimately can result in discrimination and other social inequalities.
Chantal, I'm going to interrupt and just have a quick, again, back to my question. What are the applications of that in our sporting and physical activity area? Because I think it'd be interesting to just have a sense of, I think, we've got the idea that this is, what you're looking at is AI that's really going to mitigate against and address those areas of discrimination. But what does this look like if we're talking about it for the sport and physical activity areas, those sectors that we're concerned with here, and particularly if our whole aim is to get those who are doing less physical activity, getting them more involved and more participating?
Mm-hmm. Well, I think it's actually looking at providing an equal opportunity for all. And the way, if we're talking about sports organizations, the way that people are actually getting hired, they're getting employed, making sure that there's equal access to education, and also trying to synthesize stereotypes that's out there, because it's important when we're talking about AI. How are we embedding that into the technologies? Is it an app? Is it a platform? And are we using ethical approaches in the technology that we are transferring and giving to different community members, policymakers, and people that are in positions such as teachers or even community development officers, asking them to use ethical AI practices that is able to actually be gender focused, have equal opportunities for males, females, different ethnicities. And I think it's important that us as leaders focus on that, and the people that are deploying these AI technology systems.
Chantal, thank you very much. I'm actually going to go a little bit off script and ask Alex straight off. Maybe Alex, you thought that this was going to come your way. Is this the type of data that you think or already using integrated into what you're doing in London Sport?
Yeah, I think it's I suppose there's absolutely great points there raised by Chantal. Some of our more recent work has also been looking at trying to answer your question by elaborating a little bit on the wider scope. Some of our recent work has also been looking at, actually, if we're going to get less active audiences more active, then we need to potentially start looking beyond what data has told us for a number of years. So we know that, unfortunately, if you're female, you're less likely to be active. If you're disabled, you're less likely to be active. And the more disabilities you have, the less likely you are to be active. We know that if you come from a low socioeconomic background, you're less likely to be active. So actually, a lot of our work that we've been doing has been around trying to create segments or segmentations that delve into more behaviors and attitudes. Because actually, if you think about, my mother and my wife, they're both females, but actually the likelihood of them being physically active are completely different, because their lifestyle, the environment that they live within, the access to opportunities, their understanding about the value to physical activity for each other will be very different. So I suppose, yes, the answer to the question, that's a type of data that we'll look to use, because that does tell us, that does give us a starting point. But I think it's important to start to look at actually the sort of the barriers around behaviors and attitudes and people's affinity to physical activity. I completely love the point Chantal raised around utilizing data to eradicate sort of bias around hiring, for example, and the infrastructure of activity providers, because the more diverse their workforce, then the more empathy that workforce should have towards the end user. And in particular, if they're having suffered pain points around inactivity, they are likely to understand then what is it to be like to engage a less active audience, because they've understand those barriers directly themselves.
Thanks for that, Alex. I can see, Chantal, you want to come straight back in.
Comment on that very quickly and say, Alex, thank you so much for mentioning that. And I think equality, diversity, and inclusion is very important. And I think the point that you raised is very fair. When we're talking about, let's say, gender, for example, and we're looking at sports organizations, if we're talking about bias within these systems, think about your C-suite level positions, think about senior management positions that's out there. How many of those roles were actually given to females? If we go back to see, well, what are these automated systems that's actually creating these outputs, creating your top 15 candidates? What are the algorithms that's even going inside there, and who's audited these processes to hold these systems accountable? These are questions that I think is very valid, but also, Amanda, I want us to focus and really think that there is a digital divide. The technology that Alex and I are speaking about, I'm not completely sure if this is also what the global South would be experiencing and seeing as well too. So thank you, Alex, for bringing up those points. But it's also, I think we should be mindful for other countries where my parents came from, Sri Lanka, the northern area where there was genocides that took place that ended in 2010. They are not getting the same technologies and pieces of apps that we have today and that we're speaking about. So thank you.
Chantal, thank you. And that's a really important point, that global North, global South divide. And I hope we'll have enough time to come back to that question, because I think there's a number of us around the table that would definitely like to talk to that in terms of where the divide really is. I just want to remind everybody that the Q&A function is still open. Please do put your questions into the Q&A. We will continue to weave them into our conversation that we're having right now and get the panelists to also have a look and maybe give you a direct answer. Iris, we haven't yet heard from you, and that's terrible, because we really do want to hear from you as well. Just so that we get a sort of sense of where we'd like you to come in, Iris. We've talked already quite a lot about making connections, connecting technology industry and sport technology industry to public health challenges. There's a lot of connections to be made. And it sounds to me that in GSIC, your work as an innovation incubator is very much around this idea of making connections and hybrid operation. You're working profit and non-profit. You're providing a space to engage digital tech startups to address problems like global levels of physical activity. And you're generating solutions to reach those inactive populations. But how are you actually generating those solutions? It'd be really interesting to understand better the role of GSIC in doing that. And maybe just talk through a couple of examples to bring that to life for us.
Thank you, Amanda. From the GSIC, we have been promoting a global meeting point to provide sport entities with support in their digital transformation process, trying to reduce the gap between large sport entities and a small company. Because until not long ago, innovation in sport was almost exclusive to high performance sport. But with technology and the large number of the companies developing solutions has democratized the access to it. And today, for example, we all have a smartwatch that counts our step, or a quick drying sheet, or we can also access a protection solution to avoid injuries. In this sense, currently engagement solution, OTT platform, app to get together with other athletes are available to sport institutions and to governments to support the growth of the sectors and thus increase the practice of amateur sport at all levels. During these 6 years from the GSIC, we have launched different open innovation processes, categorizing more than 1,000 solutions in the industry, thus promoting smart stadium sustainability models in e-sport, winter sport innovation solution, and more recently, promoting innovation solutions that generate social impact on society. I don't know, Amanda, if it's possible, while I finish my answer, to play in the background a video. I think no.
I think not, Iris. I think better just maybe for you to just tell us about the example that you want to tell us about right now.
Okay. Because, you know, together with the support of the Santander Bank, a sponsor of the competition such as La Liga, Copa Libertadores, or Champions League, we carry out an open innovation process to create 3 pilots that will make soccer more inclusive, sustainability, and diverse, because we believe that the implementation of these pilots will allow more inclusive and active participation of football fans in the matches, as well as promote sport activities to those group of people who has difficulty due to the physical condition to practice and experience sport. And in this sense, we are working in integrate in the HoloLens, is the glasses with augmented reality, the possibility to include the bots for the people who had some disabled, some disabled, la possibility to hear the voice and improve the experience into the stadium. No, this is one example with the Santander.
Eric, come here. I mean, in a way, there's a sort of a big question behind this still, which is about, you know, is tech, digital solutions, are they dividing? And are they a source of division, or are they further dividing society, or are they actually bringing us together? So I think we really, you know, let's sort of just focus back on that big question, because, you know, it's you know, we've heard about that there's no going back, and that the digital world really is an opportunity to reach out to more people, to have more people engage. But it'd be really useful to hear now, really from everyone, what is the important action or the important actions that we need to put in place to ensure that digital solutions really contribute positively and at scale in getting more people to be more physically active. Actually, maybe we could start that by staying with you, Iris. And I know that you've been working and looking at that connection with the policy and government area. And maybe there's a role that you see, an important action that policy needs to play in this space.
Yes. In my opinion, is positive. The relationship with technology is not to divide. No, you know, just last week we launched a report called the Sport Innovation Global Social Accelerator in the Post-COVID World, that was developed based on 3 sessions in our intergovernment working group. And you can find in our website. But with this working group, we wanted to explore what kind of the future do you wish to design, how we can use the technology, what kind of the societal and economic adaptation strategies can we imagine, how do we wish to create a solution for the next generation of leaders in the sport ecosystem, and more. And in this sense, I think the technology is the tool, And we can see how the technology can democratize the access, no? Because I think the access of the technology currently is affordable for all sport entities, and this is in my opinion the relevant a position for the startup, because I think when we can work with the startup, the sport entities can reduce the cost, and in the same way is able for all the sport entities, the amateur entities, the small sport entities, or organizations like UEFA or Real Madrid, not? And in this sense, I invite the sport entities to work with the small and medium-sized companies in their country, and this is why I think the support of the local government is very important, and the investment in create a very strong local ecosystem and help them to internationalize is one way to get value for the local innovation and make possible the access of the technology to low cost.
Thanks, Grace. Can I pull you back into the conversation on this? Because it'd be really useful to hear from you as well what you see as the role of government to catalyze levering these digital solutions that we're seeing as important, and maybe going back to Chantal's sort of point of, is this government globally, or is this something that we need to be thinking about very differently given context, global north, global south, and given different trends of access depending on where you are in the world?
Yeah, I think there's a few differences, but obviously a few similarities. There's probably one of the similarities is that pretty much every country in the world would talk about not having enough people to deliver the care level that they want to deliver, and that's consistent. I mean, there isn't one that I know of that literally has enough professionals on the ground that can deliver face to face for every single person that needs it. Right, global problem, every country. Where it's quite different is some have access to different facilities and services, right? There's plenty of facilities in some countries and not in others. And I think what we need to think about is that hybrid approach, that if there's not enough people to do face-to-face, and there potentially may not be enough, or there may not be enough access of services or service provision, how do we join the dots together? And I think for me, it's a hybrid approach, and we need governments to think about it long term, think strategically, and I say that strategically not in a criticism, but it's really hard, I suppose, to plan 10 years out when you're fighting fires today with, obviously global pandemics, and then you've got ICU issues, and you've got emergency waiting periods, and like there's all these firefighting issues that's been dealt with today. And sometimes we just need, I think, let's take a step back. 10 years out, are we going to have solved the problem of enough face-to-face people on the ground? We're not, right? We're not. We probably never will. And I think this is an opportunity. And going back to the point of today, the opportunity here is to build back stronger, to reinvent the way we think, to reinvent how we operate together. Technology, yes, there's absolutely an expense there that we can come back to in a second, but it absolutely can join people and people. And that's the way I see it. Technology is a connector of people to people, with hopefully more engagement, more personalization, more precision, and people feeling more supported, and more supported by getting all of those, well done, here's exactly what you need to do today. I see you're not moving. I see you are moving. I see you might want to join this new group that just started in your locality. Technology can help bring all that conversation. And I think we just need to, if we go back to the point around the costs, for example, being a barrier, I would say the economics behind inactivity, we know, are absolutely crazy. I mean, we've got lots of research to prove the cost of inactivity. And we also have a significant research around the cost of different service provision. And they're crazy high, right? They're both absolutely crazy high. So I would say, to reduce down inequalities properly, there's definitely a work on economics of where do we spend money, and how do we better spend the money that we're already spending. And there's some fantastic examples that are being proven in different parts of the world there. But we know inactivity, when properly reaching people, every person, it's an absolutely cheaper approach than care for essentially late stage conditions and so on. So my logic here is that it's a let's think hybrid. Let's think technology not as a standalone, but as a complement and a support tool to clinicians as well as people that haven't either the access or the knowledge of who to access when they need it.
Great. There's a question that I see that's come in, and it really, is something that I'd want to give to you, but also maybe JB, you'd have a take on this as well. Are these digital solutions actually cost effective? Do we actually have evidence to show that they are? Because you were talking about, Grace, the sort of the long-term cost effectiveness, but on I guess a sort of a more sort of short to mid-term level, do we actually see the cost? Do we actually have evidence to show this?
Yeah, and that's a good point, and it's something that we're actively doing right now. So watch this space for our own personal one with Exi. But if we take one example of cardiovascular disease, right, one of the biggest problems we have of non-communicable diseases, we look at cardiovascular disease and maybe cardiac rehab as an example in terms of very well-reported costs. First of all, in most countries, less than 50% of people who need cardiac rehab have access to cardiac rehab because of the lack of services and lack of people on the ground to actually deliver the services. So that's something. We also then know that some of the stats I was looking at this morning, for example, in Europe, it's nearly over $1,500 to US dollars to deliver cardiac rehab for like a 12-week period. That's a big cost, especially when you consider only 50% are getting access in the first place. So if we look at the cost of an implementation of a program which is digital, hybrid, supporting people at home, even if it includes the wearable, for example, into that cost, it still works out significantly cheaper. I mean, the cost of, for example, a tracker, I'm talking about like even the high-end, fantastic Series 6 Apple Watch, for example, we're looking at 400 euros. So there's a huge gap there between that. So yes, I think there's fundamentally enough research to prove technology in combination with face-to-face is a lot more cost-effective and does prove to be as effective, if not more effective, and reaches more people at home and more sustainably, and even just completely outside of where Exi is and so on. There's some fantastic work done, like Silver Cloud Health is another great example in the mental health space, which is a huge problem we're obviously going to be increasing in the next 12 months. The economics that they've proved of how they reach more people again at home with more personalization, and the cost that they've done for the UK government, and they have well researched on their website. It's absolutely phenomenal, and so yes, I would say there's plenty of research already there proving the cost effectiveness. And I think anyone who's skeptical yet, feel free, just Google it. There's lots. Take a pick, whether it's respiratory conditions and obviously COVID, cardiovascular, oncology. There's plenty of them out there. Google and take a pick. They're there.
Thank you, Grace. I think you fully answered the question. Totally passionate about being able to say we absolutely do have the evidence, and it's coming from all directions to say this is cost effective. And I guess it's a really important point coming through in today's conversation, because part of the conversation, of course, is let's look at the potential, the positive potential of digital solutions, but also let's look at how we can really scale these up, how they can actually really reach the promise that Grace, that you're talking to, this big promise that is out there. JB, can I turn, Alex, I'm going to actually turn back to you because I see that you want to come straight in, and then JB, you're going to be after that. Alex, go ahead.
Yeah, just JB, I'm just buying you a bit more time. No, I'm joking. I just wanted to enhance Grace's point, really. I suppose, two quick examples. If you think about social prescription of physical activity, so we talked about, I suppose, the cost of technology, and probably we're looking at a direct to consumer point of view, i.e., but actually technology can be a really valuable and cost-effective way of also being an enabler and being, I suppose, a tool for those that are in and around individuals. So we think about socially prescribing physical activity. There is a big project that, at least in England, where there is thousands of social prescriber link workers that are being trained. Obviously, they socially prescribing potentially support around finance. It might not only be around physical activity, but actually, if you start joining the dots around what's going on around open data and open opportunity data, and how you then empower the link workers to be able to say to an individual, actually, do you know what? there is a park run that you can join, and park run is all about that social interaction. It's all about just getting your first steps into physical activity. And I know that it's live because I can see it here. So I think that's one point. And the other one, I suppose, Amanda, is to reinforce part of your own question, which was about reach and scalability. So I don't believe that technology is a replacement for physical interaction. It should enhance the physical activity, the physical interaction. It should be complementary. But what is not scalable is having hundreds and thousands of coaches or providers of physical activity everywhere, where technology does give us that ability to scale the interactions and reach the mass without having to deploy physical people. So I just wanted to reinforce two key points, as opposed to I completely agree with Grace on that.
Thanks, Alex. I'm going to have Fiona, because I know she's got the question that she wants to ask JB, and Chantal, I know that you were going to come in straight away after that. Over to you, Fiona.
Well, thank you. And I'm seeing questions from the audience, and it's one on my mind as well. And that is the challenge we've got, that the people we want to most reach are the people who may well be least using the technologies, and therefore going back to some of the issues about what's in the technologies and potential bias, but in its core, actually meeting the needs of the people who aren't using the technology. And to me, it's a conundrum. And I'm going to ask Grace maybe to sort of tackle this first. I'm sure other panelists will. But how are we going to get the programs themselves to be written and respond in the right way to the people we're trying to reach most, who are least using it? And that's assuming they can afford, of course, the technology, and we'll come back to that. So can you help me with that conundrum?
Yeah, for sure. And it's a great point, because access is always a challenge, right? I think we need to look at not the people who already have technology. I think we need to package together what your person actually needs. So there's, and I say technology in the broader sense, someone with hypertension, for example, obviously should be looking at their blood pressure numbers regularly. So that's technology. And if they're going to be active, there's different trackers and wearables and health devices there as well. I think we need to, and I say we, as professionals of the world, think about it in a combined package approach and provide it and give it to somebody who says, here's what I want you to use. It's not only the recommendation of let's get active, it's here's your Apple Watch, for example, here's your blood pressure monitor, and here's the platform and support that you're going to need to communicate and work with us in a long term, but enabling self-care. We have to think like that. I think enabling self-care is the only way. And that if that requires putting the technology in with the service and providing it with the service, and then we have to think about that. The economics make sense. We know that if we get people moving, it costs less to care for them. So I think it's not a looking at until technology reaches the population that need it. It's let's get it to them with the support and the provision and the science and evidence that we have. I think that's where we have to be proactive and not just wait for the world to kind of catch up. Look, COVID, I think, has been a catalyst, as we all know. It's shifted the entire healthcare industry forward in thinking technology has to be used. And there's been one positive, I think, out of COVID. It has been that it's much more appreciative of technology being a support for care delivery and reaching people at home. And I think we just can't go backwards. We need to be able to think about that in a way that's economically different, not just if they have a technology, great, we'll use it, as opposed to let's give people what they need and let's do that now and not wait until they've become more okay with it. We wouldn't do that with drugs, right? We give them their drug, we give them their prescription. Let's think of it in the same situation.
I'm going to jump back in, Fiona. I am going to turn to JB, and then Chantal, I'll come straight to you because I've been promising JB that I'm going to bring him in. JB, in a way, the same question to you, though. And this is sort of because we have about 20 minutes left of the webinar, but the same question in terms of if you're talking about product development and you're in the Innovation Hub, you're looking at product development, and then Grace is saying there's a product development side to it. And then she's also saying, and then you've actually got to get it to the right people. Is that something where you sit in UEFA, you're able to do both sides of that? You know, there's the development side, and how do you do that? And then can you actually bring it to the people that Fiona's talking about, her conundrum of those who are the least physically active, who may have the least access to the types of digital solutions that we assume everybody does, but actually they don't?
Yeah, so on this, I think it depends a bit on the project. We try as much as we can to be in the driving system to push for that. So There's another business unit within UEFA who is in charge of the relationship with the national associations, so the federation at each state level, who are actually in charge to increase participation. And so we actually work with them, given on the, you were discussing on the cost efficiency. I think we did a model. We worked on a return on investment called ROI, so social return on investment. And out of 10 million grassroots players in Europe across 25 countries, we saw that there was a 38 billion return on investment, more than 16 billion coming from health and 12 billion, a bit more coming from social. So I can send you a link on that. You can find it easily on UEFA.com if you Google ROI UEFA model. It has been done with academics as well across different territories. So we make sure we actually drive value and we can showcase that this is efficient. And going back to the product development, what we're trying to do is to reach as many people as possible. And this means even the less likely to interact and to engage. So I would not say that we are the core developers, because I will be also honest and transparent. We are not the one providing the full tech. We don't have the full backend and tech stack for this, but we are trying to put in terms of like obligations that it drives for the wider social benefits. And I think that's one of the key things for sports organizations, and I guess non-for-profit organizations at large. It's like you need to do your homework in terms of like making sure you foster a culture of innovation internally to make sure that everybody is having this in mind, even the bias. But at the same time, the second strategic pillar for us is how do we leverage the ecosystem? And so you need to be in a driving seat with startups, with SMEs, so small and medium enterprise, with the academic research center. You need to make sure you foster this. And you need to keep that in mind, because I think we might allude to it at the end or as part of the conversation, but you cannot rely solely on the private sector, on the business side, because otherwise, clearly it will be dictating by business and by the margin that they can make. And so I don't think it will be for the wider good of the society. And so this is where we have a duty, just like everybody around this panel, to step in, to be in the driving seat, and to make sure that our values, the one that we defend, are truly coming together within the new technologies that we're pushing, because this is what we want at the end of the day.
JB, thank you so much. And again, I'm seeing Chantal now even more than ever wanting to jump in. And I'm also seeing what's great in these webinars is that we're seeing these sort of unexpected links and partnerships starting to grow, and a lot of echoes and resonance across you. Chantal, do you want to go ahead again? I'm still on that question of, if you like, this sort of the product development on one side, the getting it to the right people and those who are the least likely and have the least access on the other side, and how do we actually address that, and who needs to play what role in doing it? And JB gave a lot of answers to that, but it'd be great to hear from you on that as well.
That's a great thought, Amanda. And I'm going to be a little bit evocative at this moment and echo what Fiona brought forth a couple of minutes ago. I'm going to be frank and just be honest and say, I think that I believe there will be a digital divide in the future. I'm coming from a place of AI technology future that's going to be embedded. And I'm thinking about machine learning systems, natural language processing, robotics. This is a technology that's going to be automating so many systems. We're talking about a $13 trillion industry by 2025. And if technology is moving in this way, what happens to the developing countries of this world? It's equally important for us to focus in this area too. And also I'd love to ask some of the panelists, because I know we're talking about digital apps, new technology, which is innovative. It's amazing to see what these different organizations are doing, but do your infrastructures within your own organizations, how are you actually planning for the future? How are you thinking about GPT-3 technology, for example, or things that's to come, and making sure that you yourself have sustainable practices and ethical AI machine learning systems embedded into the work that you're doing, and proactively also seeing how do we care? How do we actually put some thought and emphasis on the developing countries and looking towards the sustainable development goals for 2030? I haven't heard anybody actually mention that and talk about it. And I think it's a very valid point, Fiona and Amanda, for us to focus on those long-term trajectories. For example, I'm thinking about an organization called the Youth Charter. They do amazing work in London, and they're focused on 5 sustainable development goals for the machine learning technology platform that Cornerstone AI will be building in this fall. But I think if we also take a step back to look and see, okay, how do we make sustainable practices? How do we think about consortia partnerships, for example, to try to fill those gaps? Would be important.
Chantal, thanks. I mean, first of all, a great reminder of trying to think about how our digital solutions are going to leave us sport to contribute to the SDGs. And I think that's, that's a question that we all need to have in our minds. Your challenge to all of us: are we fit for purpose for the future, not just in terms of what the needs are today, both global north and global south? So to keep that in mind as well. One of the questions that's just come out from the audience is a question to all of the panelists. It's a great last question to all of you as we start to sort of wrap up going around. And maybe Chantal, because you're still on my screen, you could be the first one, and then I'll literally ask everybody. But it's really is, what is your call to action, and to whom, to actually really see the potential reached of these digital solutions, to actually seeing more people being able to be more physically active for better health and social outcomes? Chantal, one call to action, not the 15 that you already want to give to us.
That's right. Okay, no problem. If that's a great question, I would say I would focus on the governments, or governing the deployment of these machine learning systems, any technology in the future, not just being reactive, be proactive. Don't just talk about regulatory systems and policies, be proactive and go to the data itself and fix the algorithms and the systems that's there.
Thank you. Iris, I'm going to turn straight to you. What would be your one call to action, whether it's to within your own sector, to startups, to innovation hubs, to the public health sector, government? What would be your one call to action?
I think basically this would be the summary of what I covered today. It's important to government to commit more with our sector, to put in place according policies and attract and provide investment to scale the tech solutions.
Super. Yes, thank you very much. Alex, from where you're sitting with your London ambition, but I know that you also have like a sort of a global vision, what would be that one call to action?
Yeah, a fair few in there. I was just answering to Alex directly on the chat. So if I had to pick one, I think that our sector, government, municipalities, trusts, charities, probably could do with being better at sharing our challenges, sharing our pain points, and then therefore enabling innovators to step forward and and pitch and put their best foot forward, really. So I think we understand the sector very well. We understand what is it to how we need to try to get less active audiences more active. It's about then trying to share those pain points, so we open the doors to innovators to come forward and really integrate into the sector.
Thanks, Alex. And that's really, that's sort of opening to your own vulnerabilities, to actually say, this isn't easy, and it's actually by working together. And I know this is something that all of you in this panel talk about, this idea of actually making connections across different forms of partnerships, or some people call them different stakeholders or key actors, seems to be a way forward. But it's an interesting, that sort of opening ourselves to the challenges. JB, do you want to come in?
Yeah, sure. I mean, on my side, I think from the UEFA perspective is like, how can we make sure to increase football, obviously, but sports participation at large? And so from my angle, it's more how we make sure we remain relevant. So using the startups or the SMEs, or how we make sure we anticipate future trends. And it's a bit what Chantal was saying, like being more proactive. And so open innovation scheme, just like what you said, how we make sure we recruit the startups based on the SDGs or on their sustainability aspects, things that we've done. And so I think it's mostly like this, like how we can best use technologies or new behaviors for social benefits at large. And so from echoing as well to what Alex and Iris said, I think we will never find it alone. We cannot solve the solution alone. And I think we need this kind of ecosystem where public authorities, private business sector comes in with sports organizations in terms of, okay, we're trying to align and find like the best way to scale that, to remain active, because this is what we want at the end of the day. We want a healthier and a more social benefit society. So that's why I would see it.
Thanks a lot, JB. And again, I think it's you're yet again pointing to, first of all, the proactive and the foresight piece, which is really interesting. And I think it's sort of something that's come out through the webinar that maybe you weren't expecting to be such a strong piece in this webinar as well. And the blend of actors, and it's not one sector or another, one group or another, but it's actually that blend, which is actually going to mean that maybe we can actually scale some of these solutions that you are all working on at the moment. Grace, coming to you, your call to action, trying again, it's really hard to take it down to one, but let's see what your priority call to action would be.
It's probably a synopsis of some of the others, to be honest with you. I think if I just narrow down to 2 sentences, one is stop thinking in silos in terms of health and fitness and industry and conditions and so on. And 2 is asking governments and policymakers to accelerate the need and the opportunity for partnerships. We only do this in tandem. I don't think any single individual technology is going to do it on its own, or any single part of technology is going to do it on its own. And yeah, I think partnerships and policies to support, and I won't say force partnerships, but support and leverage and actually embed partnership as a standard is absolutely necessary.
Grace, thank you so much. At this point in the day, this is where I actually hand over to Fiona, who has this tricky job of actually trying to sort of pull this together and conclude, wrap up, synthesize the conversation so far. Which means that it's my job just to thank all of our excellent panelists, Chantal, Iris, Alex, Grace, JB, for your contributions. My apologies if I took us off script, but the conversation was so interesting, I was too tempted, and so had to go down some other lines of conversation. Fiona, over to you, and as always, good luck as you try and wrap this up.
Well, thank you, Amanda, and thank you to all the panel members. This has been a fascinating discussion, and thank you to the audience who are engaging with the Q&A and the chat. And we will note these questions and continue the discussion about this. I say each week how hard it is to do this job, and this week, of course, is even harder than others before. But let me highlight some of the key things which have come out. We've heard examples of the applications of digital technologies at the individual level and at the environment level. The 2 aspects we know, one or the other is not enough. We've heard about joining the dots, the providers and the seekers, and digital can help us do this so much better. And it can help us at the individual level to nudge, remind, incentivize, and even gamify and build enjoyment and participation. But we also heard it must be simple. It has to be simple or it won't be effective, which was really underpinned by comments, understand your consumer, understand the user. And there's expertise on this panel and elsewhere to bring to this. So overall, there's been a message of optimism that the digital applications can address key issues, finders and seekers, the individual and the scale, the opportunities, and we can take that to scale. It can reach many, many people. We also heard that's a good investment. The numbers add up, evidence is further needed, but the cost of inactivity really will drive that we need to invest in these scalable solutions. However, we've got to foster this development of technologies, incubate it, catalyze and accelerate it. And there was a role for government in this, local governments and national governments. We can't leave it to the private sector alone. We've got to bring small and medium enterprises, tech industry, public health, sport, science together to have the solutions generated. And there's a role for everyone. a strong theme by our final panelists' remarks is about working together. We can't do it alone. We've got to stop the silo thinking and better work better together to find these solutions. But we're left with that nagging question, a question challenged that whether this will continue to divide. Those who can't access the technologies will remain excluded. So it's a challenge to those innovators, to the innovation challenges we might want to put out through incubators and government. It must be inclusive, address inequalities, and avoid the biases that we heard that can occur, may occur, are occurring. And those values that we all share must be brought on the table in the development of technology and digital solutions. So a mixed message, lots of optimism, but some key questions remain unanswered and challenged by our Q&A. It's not a finished discussion. This one's definitely going to go on. We've heard a lot. Thankfully, we record these and the recording will be available within a week. So we'll direct you if you're listening, and of course, those who hear about this later. It's time to move on to what happens next. We take the learning from this webinar and our previous webinars to next week, where we start to bring things very much together, because a resounding theme is investment in this field, investment in a stronger sector, a stronger system, and a connected system. But we do need to justify that investment. And so measuring and indicators, reporting and accountability, they're hand in hand with stronger investment. Join us next week. Excellent panel from around the world joining to tell us what their thoughts are. We've already heard some in previous weeks about changing how we invest, the need for innovation in financial mechanisms, not relying on charity. So we need to discuss this. Join us for that next week. And of course, we're recording all of these seminars, and many are available. And in the chat box, we'll put the links to those recordings that are available already. So thank you for joining today. Thank you for joining the series. We welcome you back next week, and I extend my thanks to those who are coordinating the technology today, to Amanda for her excellent moderation, and last but not least, of course, to the excellent panelists for giving us their time. And I'm sure they're going back to their day jobs, which is innovating and digital solutions, hopefully informed by today's discussion. Thank you and goodbye from WHO.